Welcome, welcome. Um, Good afternoon. My name is Katie Hubbard. I'm the Wellness Coordinator for University of Michigan Health Plan. As your host and speaker today, it's my privilege to welcome you to today's webinar entitled Movement is Medicine, What Exercise Can Do for You. The webinar is being recorded today, so your videos and audio will remain muted, but please feel free to utilize the chat for any questions, and I will do my best to get to those either during the presentation or I'm going to be circling back afterwards because I'm guessing that there will be a couple that I can't get to while the presentation is going. Pleased to see a lot of familiar faces and names today. For those of you whom I haven't had the pleasure of meeting yet, let me tell you a little bit about myself and why I'm so excited to be able to speak with you today on this topic. So I finished my bachelor's degree in exercise science from Indiana Wesleyan University, and then continued on for a master's in clinical exercise physiology from Ball State, during which time I was working at Lutheran Hospital in Fort Wayne, Indiana. And during the last 15 years, I've covered a variety of clinical and community roles, and I love it. So I started in medical and surgical weight management and kind of transitioned on through cancer rehab and cardiac rehabilitation. And then more recently, I've worked in community roles, teaching kinesiology classes at Lansing Community College, and also teaching community exercise classes for seniors. So sharing health and fitness is a passion of mine. I also enjoy reading and baking and traveling and spending time outdoors in my spare time. I'm a firm believer in the power and the importance of exercise, both for physical health and personally and importantly for mental health and well-being as well. I'm really excited to be able to speak on today's topic because it's near and dear to my heart. It's part of what got me hooked into exercise 20 years ago, and it's why I keep exercising and why I know a lot of you who are here I'm preaching to the choir. You guys are doing this stuff too, but hopefully today you'll leave feeling motivated and encouraged on your own exercise journey. So today we're going to dive right in and we're going to discuss the ways that regular physical activity can disrupt that aging process and why it's so important to be able to get and stay physically active as we get older. I'll also share some tips for getting started with exercise, and also for those of you who are dealing with chronic conditions, some resources that are available that hopefully would be helpful to you. So let me go ahead and start sharing my screen here. There we go. So we know that a single session of exercise is going to have some immediate benefits, but there's also a whole host of benefits that we get with exercise training. And a lot of them have to do with the prevention of chronic or decreased risk for chronic diseases. So these are just a few of the ways that a sedentary lifestyle can increase your risk for a lot of chronic conditions. There are a host of health benefits of physical activity. The immediate ones, like you might feel better afterwards. Oh my goodness, I did my exercise today. And you have increased energy level, maybe increased mood. Maybe you notice that you sleep better just from a single bout of exercise. But over time, when you engage in exercise training, you see decreased risk for dementia, depression. It lowers your risk for heart disease, stroke, type 2 diabetes, lowers your risk for several different types of cancers that have all been tied to a sedentary lifestyle. It reduces the risk of weight gain and helps improve bone density. It attenuates that muscle loss that tends to happen as we get older. So it preserves strength and independence, reduces your risk of falls, and actually also helps boost immune function. So there's lots of benefits, and I'm guessing most of you could recite some of these, but I want to delve into some of the cognitive and the psychological benefits more so today as well. So I like this comic. If exercise were a pill, we would all be taking it. It's so powerful as far as the different processes that it directly affects for preserving our health and independence. Research shows that a lot of the changes that are attributed to aging are actually caused in a large part by disuse. We start to withdraw a little bit as we get older. Maybe our memory's not functioning quite like it was. Maybe we're not comfortable driving after dark because our eyesight has declined. Our hearing is not quite what it was when we were younger, maybe through just age or damage. And so we're challenged to keep interacting with people, and all of those things can affect our desire to get out. And dopamine, which is a huge driver for motivation, those are things that, again, attributed to aging, but again, just part of disuse. And so we got to stay active, and activity, our physical activity, can help affect a lot of those processes that keep us engaged and motivated in our everyday lives. So we're going to cover 10 things, and then I'm going to go into a little bit deeper on a few of them. 10 different ways that exercise counteracts the aging process. Regular exercise helps to lower blood pressure and strengthens your heart. Exercise can, to some extent, also counteract some of the vascular damage that can be seen in Alzheimer's patients or stroke victims when they are when they're able to regularly exercise. They've seen increased improvements on cognitive scores, cognitive tests for individuals who suffered a stroke and start an exercise program. Same things that goes for Alzheimer's patients. So super important for helping to maintain healthy cardiovascular system. As we strengthen our heart muscle, we can increase our stroke volume. So our heart is able to be much more efficient with each contraction. It improves perfusion. We're able to increase capillary density at our muscles. So it's a much faster way of getting oxygen to the working muscles. And it just decreases the stress on the blood vessels. So much better contractility, a lot better decreased arterial stiffness. Again, all super important, and exercise directly affects that through a number of chemical processes that go on during the actual exercise. Exercise also helps promote healthy skin. We know that increased blood flow can help get our nutrients to our skin, our hair, and nails, while removing free radicals and waste products that can kind of build up. We know that regular exercise can also help decrease stress levels, and decreased stress can also potentially decrease acne and eczema as well. So great. It's nice to have good skin, and that's kind of like a nice benefit of regular exercise. We know that with exercise helps to activate our GLUT4 transporters, which are in our muscles, which help to bring that glucose into the cell without the use of insulin. So it helps to regulate our blood glucose levels and support a healthy body weight. As we age, our insulin levels drop, and our glucose has a harder time getting into cells. And so that elevation in blood glucose can cause inflammation. It can damage our blood vessels and increase our risk for stroke and for Alzheimer's. With excess weight, we increase our chances of developing dementia. And then if an individual has high blood pressure and high cholesterol, the risk increases even more. So when we're exercising, we're able to burn our calories. It helps to reduce our appetite. I don't know about you, but if I do like a really intense exercise session, I don't have an appetite right away afterwards. And so that also has its own benefits. Exercise helps to reduce your stress threshold. We know that exercise is fantastic for stress management. It combats the damaging effect of cortisol, which is a byproduct of chronic stress. And one of the research studies I think is really fascinating. It's by Philip Holmes, who's the University of Georgia neuroscience professor. He showed that over the course of several weeks, exercise primes the brain to show less stress in response to new stimuli. Kind of helps us keep our cool when we're faced with unexpected events. And I think that is, phenomenal. It's in your everyday life when you're dealing with things. And if you have a regular exercise training, it helps you be able to put things in perspective a little bit better. And that again is just one of the benefits of regular physical activity. Exercise improves mood, and we're going to talk about this in a little bit more detail later on, but it also improves your motivation and your energy level. Exercise counteracts the natural decline of dopamine, and also works to boost motivation by strengthening the connection between the dopamine neurons. Our dopamine levels naturally diminish with age, and so with that, when we move, we're boosting our motivation by strengthening the connection between those dopamine neurons. And it helps guard against Parkinson's and depression. So again, really helpful. We know that with our energy level can be a big reason for exercise. And when we're able to exercise, we have a nice boost in energy afterwards. We feel better. We feel like, I don't know about you, I feel like I can like take on the world and I can get everything done. And I usually will make lots of lists afterwards. When you exercise, your blood flow right afterwards goes back to that prefrontal cortex, and that's responsible for like your executive functioning. So you could do like better task analysis, complex details, any tasks that you have, like especially critical thinking tasks. If you have work, a big project that requires a lot of focus, if you can exercise like an hour before and then shift your work on that, you're more likely to be able to have better focus during that time because of the exercise previous. There's actually some really interesting research out of the University of Illinois that looks at it was a school district, I think Naperville, Illinois, and they added exercise in as like a 0 hour for some of the kids that were really struggling in math. And what they did is they had them exercise prior to going through classes and prior to going to their math, and they found improved test scores because they were able to add in that physical activity. It helped prime the kids' brains for learning, for being able to remember and organize key details and be able to recall those facts through their spatial memory. So just some fascinating stuff there. We know that exercise helps preserve bone mass, helps improve strength. It combats that age-related loss of muscle, which happens, unfortunately, commonly as we get older. So even just any little bit there, but focusing on what you can do and then building on it. Obviously, starting when you're young is best, but there are significant improvements that can happen with improved strength if we're starting at an older age. Even this one Harvard study that I found looked at 87 to 90-year-olds who began a weightlifting program, and they found significant improvements in muscle function. And that was, really encouraging to me. I thought, man, if you're starting weightlifting at age 50 and you feel like, oh, I'm so behind, but like you are so ahead, because if you can start lifting weights at age 50 or figuring out a different way to do body weight exercises to help increase muscle strength and muscular endurance, they're doing it at age 90 and they're seeing big improvements. So anything counts as far as that's concerned. It helps preserve bone mass, decreases your risk for osteoporosis and osteopenia. And obviously that's going to preserve independence. Fractures are debilitating, especially to older adults. One hip fracture or one wrist fracture can really decrease your physical activity, and it's like a downward spiral. How many of you exercise for sleep quality? This is a thing. I know this is a thing. We know that moderate exercise can improve the amount of slow wave sleep that you get. Regular exercise also helps to drop your core temperature while you're sleeping. Your body's got a faster temperature response, and so that can help you sleep better. Yes, and regular exercise can help to stabilize your mood and decompress your mind. So if you're like me and you have to have like a list of things by your bed, that way you can write down the things so you don't forget them, and you don't have to worry about, oh my goodness, am I going to forget this in the morning, or I can't remember, or I can't forget that I need to do this. Exercise can help prime your brain so that it's easier for you to unwind at night. So you can still keep the notepad by your bed, but exercise will help with that as well. One study found that 150 minutes of activity a week can lead to a 65% improvement in sleep quality. So 150 minutes is what the National Institutes of Health and the CDC are recommending for most active adults anyways. So shooting for 150 minutes may actually lead to a sleep improvement. So that's a nice perk as well. We know that exercise can reduce pain. The body releases endorphins that can help dull the body's perception of pain. There was a study that shows that exercise can be an essential tool in the treatment of chronic pain. They found that moderate exercise, and this was like aerobic exercise, so walking, jogging, swimming, or biking, showed increased tolerance to pain and decreased pain perception. So they weren't rating the pain as highly, which obviously is going to help improve quality of life and the ease of which you're able to perform activities of daily living. So maintaining independence and decreasing that body's perception or your own personal perception of the pain that you're experiencing. I saw this firsthand when I worked in cardiac and cancer rehab. It was amazing to me. Regular exercise, patients were excited to come back and get on the new step or get on the bike or get on the treadmill. And they we're able to directly tie that to some of these benefits that we're talking about: the increased sleep, the better able to deal with pain. Amputees are able to, if they're able to exercise using an arm ergometer, we're able to notice decrease agitation with that phantom limb syndrome, and they had decreased pain as well. And I thought, some of it's just anecdotal, but the fact that they kept coming back for exercising spoke volumes to me. If you're on chemotherapy and you're working with your doctor, and your doctor says, "Hey, have you thought about cancer rehab?" And maybe you haven't, but you try it and you figure out how you can make it work for you, and you work with your clinical exercise physiologist and your oncology team, and you're able to see some of these benefits with increased energy and decreased pain in your daily life, and it makes you want to keep coming back. It's encouraging, and it's awesome to be able to help someone like that. Exercise boosts the immune system through two big ways. First of all, it increased, even just moderate levels, increase the activity of our antibodies and T lymphocytes. So when I'm sick or feeling like I'm starting to get sick, I usually try to get the exercise in. I don't try to skip it at that point. Whether I'm just at home biking or if I'm going for a walk myself, just to keep my activity levels up. Obviously, maybe not going to the gym, where you might be at risk for spreading something, but in a way, if you can keep your own physical activity level up, it does help to rally some of those antibodies and lymphocytes, which can help fight infection. It also helps keep our inflammation levels under control. So that's the second one. Again, unchecked inflammation can wreak havoc, increase the risk for cardiovascular disease. Alzheimer's and other types of dementia can be affected by inflammation levels as well. So we want to boost our immune system. And then neuroplasticity. Neuroplasticity, it's a mouthful. Neuroplasticity is the brain's amazing ability to be able to adapt and change. Aerobic exercise strengthens the brain by strengthening the connections between our brain cells. So the stronger the connections, the better prepared your brain is to handle any damage it might experience. Moving keeps our body active by strengthening the supply of neurotropic factors, which helps increase our neurogenesis, which is our creation of new neurons and brain cells. And that's an important thing as well, because those do naturally die off. And so we want to continue to focus on new pathways and strengthening those synapses. Starting at around age 40. So, we lose 5% of our overall brain volume per decade. That's a lot. And the neurons do get worn down through cellular stress. And obviously, as there's activity at the synapses that starts to decrease, the brain cells start to die. We start to pull back as far as our blood flow. The capillaries die off. There's not getting a lot of blood flow. And again, it kind of is like a cyclical process. Things like brain growth factor, which is a key protein that helps nurture that neurogenesis and neuroplasticity, and dopamine, which again helps with motivation and motor function, all tend to decline with age, but exercise helps to boost them. So what exercise does is it increases our oxygen and glucose to the brain. It's the only thing that goes across that blood-brain barrier, and it triggers the release of BDNF. So BDNF is a brain-derived neurotropic factor. It's like Miracle-Gro for the brain. So after we exercise, the blood and our BDNF go back to our prefrontal cortex, and that's where we're, again, responsible for executive function. It's a great time to focus on something that demands our critical thinking. Again, it helps preserve those synapses. It preserves a lot of the neurons, and it allows our body to increase those collateral channels, increase our blood flow to key areas of the brain, which we need to be able to maintain our memories and our independence, and our cognitive function, which is so critical and so important, especially as we get older. Oh, I love this one. So this was Arthur Kramer. He's a neuroscientist out of the University of Illinois. He looked at some aging seniors to see what would happen as far as cognitive function. And what they did is they sent the group to the gym 3 times a week for 1 hour. So half the group did stretching exercises, and that was the control group, and the other half walked on the treadmill for the duration of the time. So it wasn't anything real strenuous against ages 60 to 79. They found that the exercise group was able to increase their VO2 max which is a measure of aerobic fitness, by 16%. They increased, but the landmark finding was that they increased their brain volume in the frontal and temporal lobe. So they did MRI scans before and after their trial period. They found that the volume in both the white and gray matter in the frontal, prefrontal, and temporal cortices increased. It was a statistically significant amount. And the thing with that is those are the areas that tend to have more of the age-related deterioration. And so researchers were really excited, and the group especially was really excited about this finding. They've done a couple of follow-up studies to explore it a little bit more, because those are the things that are declines in those areas are associated with everything from like schizophrenia to Alzheimer's disease. And so maintaining our brain volume in those areas of the brain were really critical for clinical health and for overall well-being. And that's they've done a couple other ones that were similar to look at, like, how does this affect memory, and how does this affect like BDNF? Again, that's that Miracle-Gro, that brain-derived neurotropic factor, which is really good for maintaining our cognitive flexibility and be able to maintain our memory. So that was, just huge. The psychological benefits of exercise, I've mentioned depression. It also helps to decrease anxiety and improves our confidence and our self-efficacy. So we feel better about ourselves, whether you're, I feel more confident in how you're looking, or you just feel more confident about your life in general. You have increased quality of life. You have those increased endorphins, and your increased ability to handle stressors that come your way. And again, it's just kind of overall feelings of enjoyment, self-confidence, and then improved mood from the exercise. Those are they're huge to me, because if you're physically healthy, and maybe you're not real concerned about cancer because maybe it's not, you don't have a strong family history of that. Maybe you do, and that's a motivator for you. But if you're otherwise healthy and you're just struggling with some day-to-day stuff or work stress, you might notice an immediate improvement in how you're feeling after you exercise. And you may not have even ever considered exercise as a way to help how you're feeling with things. If you're feeling overwhelmed or you have a lot going on and you're struggling to cope with your day-to-day stresses, exercise could be a really helpful tool for you. Exercise increases endorphins and endocannabinoids. Those are the ones that help reduce or dull our body's perception of pain. It also regulates all the neurotransmitters that are targeted by antidepressants. So that to me is remarkable. It is like a wonder drug for your mental well-being. There's a book. It's fantastic. I highly recommend if you find this stuff interesting. It goes into a deep dive. Dr. Ratey is a practicing psychiatrist, and he's on the faculty at Harvard Medical School. He's written, I think, 7 different books on brain health and brain function. And it talks about how exercise and the different ways that exercise affects the brain. And some of the stuff that I'm sharing with you today as well. But just got to put the plug out there because it was a really helpful resource. Dr. Ratey is a firm believer in the power of exercise, especially for working against depression and anxiety. He said in Europe, doctors are using exercise as a first-line treatment against depression, but it's vastly underutilized in the US. So if you struggle with depression and you're taking Zoloft, I am in no way suggesting that you should change your treatment plan. However, I would suggest that maybe you could use exercise as an assistive for your current treatment plan. One of the research studies by Blumenthal and his colleagues, they looked at adults with major depressive disorder through self-report and clinical interview, and they assigned them to either a 4-month course of aerobic exercise, medication, or a combination of both. And all of the groups had significant improvements. So you can see the green lines there are the before. The first section is antidepressants alone. The middle is exercise alone. And then the third is a combination of antidepressant exercise. They all exhibited significant improvement before and after. And 60 to 70% of them can no longer be classified as having major depression. After 10 months, so there was a follow-up study, Babiak et al. looked at the same cohort of participants, and they circled back at 10 months, and they found those in the exercise group had lower relapse rates. So they were wondering if exercise had more of a protective effect than just the medication alone, or a lower likelihood of relapse to depression. So interesting. I thought it was fascinating. Hopefully you find it interesting as well. There are a lot of research studies out there that look specifically at depression and how physical activity, because it targets all of the neurotransmitters that, again, are typically targeted by antidepressants, because of the fact that it can affect all of them, usually it has a pretty substantial effect on your mood and how you're feeling, and some of those depressive symptoms. I wanted to do a brain break with you today. So I'm going to stop sharing my screen just for a second so I can go back and check the chat. Yay. Super. Okay. So you're going to take your right hand and you're going to touch your left ear, and you're going to take your left hand and touch your nose. This is just a way that you can engage both sides of your brain and wake your body up a little bit. And then we're going to switch it. So we go. I practice, and I'm not even doing that good. Do it a couple times. Take a deep breath. Awesome. The other one that I would share with you is it's called ABC 1, 2, 3. And this is a fun one to do. I've done it with older adults. I've done it with kids. It's super easy. I usually invite you to stand up for it. You don't have to, but you're going to extend one arm out in front of you, and you're going to trace the alphabet, big letters. So A, but you're going to say 1, 2, 3, 4, so on and so forth. So you would count to 26 and hopefully end at Z. And if you want to increase the challenge for yourself there, you can count backwards and start at Z and go to A, or you can use your non-dominant hand. So I'll leave that up to you, how you might want to do that. But the brain breaks are great. All they do is they just kind of reset the brain. They kind of wake you up. If you're during the workday, I would recommend that you get up. And I know some people in my work are known for doing this. They will get up and take a lap around the office, indoors or out. So if it's raining, you could do some stretches at your desk. You could walk a loop around, whatever it is. Find a way to reset your brain, because if you are sitting all day, the muscles in your back and shoulders and the tension that you carry, it is challenging to unwind, and that chronic tension can cause some pain and discomfort over time. So get up and move, and that's a great way for your body to kind of reset during the day, refocus. So who should exercise? I know that you know exactly where I'm going with this. Almost anyone at any age can do some sort of physical activity. I recommend that you talk with your doctor about what type might be safest for you. If you're currently seeing a physical therapist, another exercise professional, you can talk with them about what might be a good place to start. If you have a heart condition like heart disease or diabetes, activity may even help. So start slow, listen to your body, and again, work with your doctor on that one. For a lot of conditions, exercise can be preventative as well as an antidote. So it's something that can certainly help improve a lot of clinical conditions. The U.S. Department of Health and Human Services recommends that adults get 150 minutes of moderate intensity aerobic activity per week, plus strength training activities. If you prefer vigorous exercise like running or doing like a spin class, the goal is 75 minutes per week. But honestly, whatever you're doing, keep doing it. So if you want to continue to maintain your benefits, if you're already doing like 4 days a week of 40-minute classes, keep doing that to maintain your fitness level. This is just kind of a guideline to shoot for. There is not a lot of research tied. I can share what's like the Blumenthal study on depression. They did 3 times a week for about 30 minutes of on the treadmill at their target heart rate zone. So 30 minutes 3 times a week is not 150 minutes, but it was enough of a dose in order to get the response and improvement in their overall mental well-being and their depression scores. So anything is helpful. More is better. There's not a lot of really clear research as far as what the peak, and it may vary from person to person as far as what the dose response for exercise is. You may find that you need to exercise every day. I have found that my mental health does not do good if I exercise every day. I tend to respond a little bit better when I can exercise 2 or 3 days. So it's different for each person, and you just have to figure out what is going to work best for you, what you enjoy most. If you are in the older adult category today, you may want to add in some balance activities, things like pickleball, Tai Chi, any other sporting activities that require some coordination and balance work can be really helpful. Yoga could fit in there too. To help improve balance, because we want to help maintain balance and preserve independence to decrease the risk for falls. If you think you are too old, take heart. There are Ernestine Shepherd, she's on the far right. She started exercising when she was 56 and she's 88 now. She wakes up every morning to run and lift weights. She's finished 11 marathons and done several bodybuilding competitions. Daoja Singh ran his first marathon at age 89, and he's still running at age 113. And Anna Peace had scoliosis, very hunched over, suffered debilitating pain, saw a number of doctors, and just really struggled. But through finding someone who specialized in back care and yoga, she was able to work. And after 2 years with doing stretching exercises and continuing to work at it, she stands tall and her pain level has decreased. And she also has reported higher levels of independence because she's able to drive again. And obviously the pain being a huge factor there. So regaining the independence is remarkable. When you start with exercise, if you're not currently active, you want to find something that you enjoy doing. So if you are interested in like sports, there are a lot of the Michigan Athletic Club, the local YMCA, the community centers offer club sports or ways that you can get moving in a group atmosphere if that's enjoyable to you. You might find better additional benefits from like mind-body activities. Yoga and Tai Chi can help improve anxiety and enhance relaxation. And they can also, when you're thinking through things, I know Tai Chi in particular, you memorize a series of movements, and that may provide additional neurological benefits because you're having to focus on some of the cognitive skill. You're doing some cognitive work along with the exercise. When I'm doing exercise, sometimes it's a struggle to count sometimes. So if I'm counting reps, sometimes that will to me count a little bit. But if your fitness level is low, think about chair exercise or just starting with shorter, smaller sessions and working up gradually. If your knees are bothering you and a pool is not, you don't have access to a pool to be able to go swim, then maybe starting with some chair exercises or doing some stretching, grabbing some hand weights, a resistance band. There are lots of ways to be able to start getting some of those benefits from being physically active. These are just some general safety tips. My biggest thing is you need to listen to your body. Exercise should not hurt or cause pain. So if exercise is painful, you definitely want to reach out to your doctor, modify what you're doing. If you have an exercise professional, like a personal trainer, clinical exercise physiologist, physical or occupational therapist in your life or treatment plan, and you can talk with them about it for a substitution exercise, if it's like a strength or endurance-based exercise, or if it's just making you really tired, find something different or modify your intensity, maybe scale it back a little bit to start. Make sure that you give your body plenty of time to recover. So if you're just starting with walking, or you join a pickleball club, twice a week may be a good place to start until you're able to kind of build up your endurance to do it more frequently. These are some fantastic resources. If you are dealing with chronic conditions, the American College of Sports Medicine has a RX for Health series, and it tackles 30 different medical conditions with specific advice. They're available. They're like PDFs. They're in English or Spanish, and these links, which I will email out to everyone with the presentation, there's a link here that you can go right to the webpage. Same thing with the National Institute of Health. They offer some specific guidance for chronic conditions. And this one was Exercise Right for Chronic Conditions. It's from Australia, but they had some really good resources and some different conditions that were not listed on the previous two resources. So I thought to include it. Oh, shoot, wrong way. Other resources, just because I like sharing things. So this is like more for you. Take it or leave it. Nike Training Club is a free app. For those of you who wear a Fitbit, the Fitbit app has a upgraded subscription that you can use too that provides a little bit more specific exercise guidance if you would like that. You can also join walking challenges and fitness challenges that way. YouTube. If you are qualified for Silver Sneakers, there is a YouTube Silver Sneakers. And even if you don't, I did one of them yesterday. Anybody can access it. So if you go to YouTube and search Silver Sneakers, and the link is here again, also embedded here, you will be able to see some of their exercises. For those of you who are old enough to remember Leslie Sanson's Walk Away the Pounds, she has her own YouTube channel, and for free of charge, you can follow along with her in the privacy of your home and do her walking workouts. That'll be like your blast from the past. For those of you who have a little bit higher fitness level and you're looking to add in strength training at home and you have some weights, Heather Robertson is phenomenal. Again, free workouts. I like her. She is definitely a higher intensity. So I would recommend having some previous exercise knowledge with regard to form appropriate modifications before starting those workouts. There's also a whole playlist on exercises for older adults. And I'm just going to show you this because I think it's so cool. You can just scroll right on through here. So if you're in the older adult category, there are show you different forms for different ones, stretches, chair dips, flexibility and cool down, balance exercises. If you are like, ooh, I need to learn some new balance exercises, there are some options here for you. Get Set Up are classes for seniors by seniors. And so those are free live classes as well. That link is in there. They are exercise classes as well as like hobby-based classes like painting or baking or cooking. So just something, it's the goal was to keep older adults both mentally active and physically active. So there's something for everyone there. And then Enhanced Fitness is a phenomenal evidence-based exercise program for older adults. There are locations within the greater Lansing area. There are locations across the state and across the US. Enhanced Fitness has been shown to increase cardiovascular fitness, improved muscular strength and endurance, decreased risk for falls, and they're phenomenal. So that's a good resource to check out if you're interested in doing something with a group and you want something that is safe and targeted for older adults. Those are in-person classes, and I think they're like $1 a class. They're very affordable. Doing my thing again. Words of advice, sticking with it is easier than starting over. There's Maxine, you just do the best you can. You have an off week and something comes up, just roll with it, modify it as best you can. Injuries are really challenging, or if you're on vacation or you have a lot of work changes or a change in scheduling with regard to family members, it can be tricky if you get thrown off your game. Just do your best to pick up where you left off and, schedule your workouts for the next week. At this point, it's so important, so you don't want to miss it. Other sage advice, one day at a time. Be kind to yourself, speak kindly and recognize that all that you've already accomplished. I find that it's a lot easier to move forward when you come from a place of self-compassion and recognizing what your body has done for you and appreciating it, and then using that to fuel your motivation for moving forward. So hopefully today you've gotten some ideas about the benefits specifically with regard to cognition and increased mood, decreased risk for depression that exercise can offer you. Hopefully you understand some of how exercise can be a tool to decrease your stress and anxiety, and boost your mood and improve your resiliency. I know that is a lot of information. I'm going to stop sharing my screen. I do have the sources at the end. There are a ton of them. But I'm going to email this presentation out in a PDF so that everyone can have access to it. Yeah, I know it's a lot of information all at once. Well, hopefully the resources will be helpful. So look for that email later this week. It'll have the link to the recording as well as the slides themselves. Thank you all so much for sharing your day with me and for listening to me spout my excitement about exercise. Hopefully you were able to pick a few things that you can take with you with regard to your own exercise. And if nothing else, hopefully you understand why being physically active and staying physically active can help protect against some of those neurodegenerative diseases like Alzheimer's, dementia, depression, and anxiety. So thank you again. I hope everyone has a good rest of your Tuesday, and I will look forward to seeing you in the next one.